Here the timer says 50 minutes, but it's 1 hour. We have 1 hour at our disposal. So good afternoon, everyone. It is a great pleasure to moderate this session. A session with a very beautiful title, Smart Systems, Smarter Policies. The purpose of this panel discussion, in order to set the framework, is to touch upon some issues that are not that associated with digitalization, digital transition. We will try to touch upon issues pertaining to digital transformation, a paradigm shift, if you like, in the healthcare sector, in the way that policies are implemented in the decision-making process. And in order to do that, we will try to answer some questions pertaining to where we stand globally. Our speakers here today are highly specialized in this field. We are also going to touch upon the current state of play in Greece and which are the conditions to ensure an effective digital transformation, and why it is better to have an holistic approach to digital transformation instead of making some sporadic interventions. The discussion will be held in Greek, and on my left we have a panel that is the best panel to talk about these topics. It is a mix of people involved in politics. We have Mr. Anagnostopoulos, Secretary General for Information Systems and Digital Governance. We have Mr. Athanasios Tsanas, Professor in Digital Health and Data Science, Edinburgh Medical School. Ms. Psalti from Microsoft, who will give us some hands-on examples of where we're headed with regard to AI and health data. She will give some very specific examples of the present day from Microsoft. We have Ms. Angela Spatharou from IBM, who will also going to give us a perspective of AI. And also, she will talk about the necessary conditions for an effective digital transformation of the healthcare sector. We have Mr. Ioannis Pandis, who is head of the Pfizer hub in Thessaloniki, a major investment that was made in our country. Mr. Siete Braak from Roche Diagnostics. And last but not least, Mr. Antonis Karokis, External Affairs Director from MSD. So you can see that we have a wonderful mix of people representing pharma industry, IT industry, politics, academia. We will start with Mr. Anagnostopoulos. We have agreed to give you 5-6 minutes so that we can have some time later for a more detailed discussion. Thank you very much. Good afternoon. Thank you very much for giving me the opportunity to talk about smart healthcare decisions. I would like to thank the AmCham for the invitation. I would say that the Chamber is always focused on issues having to do with technological developments, but also in regard to the healthcare sector. So this is something very positive, and I hope that we will continue having similar discussions in the future, because the health sector is not just a sector where IT is applied. The healthcare sector has some specific characteristics, even with regard to the technological approach that we follow. And this is evident globally. If we take a look at the sums that are invested in technology, especially in AI and technological approaches, technological solutions that improve everything in the healthcare sector. So on my part, and as an academic, because I wear two hats, I'm a general secretary and an academic at the same time, I would like to say a few words about what we do as a Ministry of Digital Governance in collaboration with the Ministry of Health, always with regard to health-related issues. All of us know that smart decisions need to be taken in the health sector for reasons having to do with the result. But what a smart decision really means is something that we also know. Intuitively, when it comes to the provision of health services, a smart decision means creating drugs that are based on data that are properly processed so as to have the opportunity to develop customize the treatment for the patients. So it has to do with the production of the drug and the implementation of this drug on the right patient. These are two very important issues. I would like to insist on the fact that all this is based on the fact that we have very good quality available data that allows us to produce the drug and then to select the right drug for the right patient in order to provide customized care. Moreover, smart decisions have to do with the hospitalization of a patient. If someone has a problem, gets out of bed and falls, then you understand that this may have major consequences. Now, there are systems that can actually monitor the patient in order to prevent these types of problems. So this is part of a smart system. Thanks to these smart systems, we can anticipate these things and we are in a better position to deal with them. Do we all agree on that? Yes. And when we come to IoT space, that is Internet of Things, sensors, devices that can understand what's going on during the hospitalization, and devices have to do with the monitoring of the patient. You know, and I'm sure that you know. I'm not telling you anything that you don't. I know you know, and I'm sure that you all read the international literature with regard to health-related issues. So what do we do in order to do all these things in reality? Where were we and where are we headed? If we manage to answer this question, we will be able to know which are the steps that we need to take in the future. Now, the truth is that our country has the possibility and could easily become a hub in two sectors. The first, as you know, we are doing very well in tourism, and we could actually associate that with the sector of services provision. This could allow our country to open up to new markets, and we understand that this is extremely important also in relation to the geopolitical stability of our country and to the opportunities that our country offers being a member state of the European Union. So we're talking about a totality of factors that can be taken into consideration when we talk about our country being a provider of services globally. Now, with regard to what we have done so far, as you know very well, in the past, any of us, if they hurt their leg and went to a hospital, then if the day after they hurt their leg again or something else happened, no one would know, and this incident wouldn't be recorded. You know that with regard to digitization, digital transformation, we hadn't done any major steps in the past. That is why we didn't have any type of services based on data. Now we have the electronic file that needs to be in the hospital so that people know when you were hospitalized, but also at the national level, which means if you go to another public hospital at another given moment, there people would be able to know that you have been hospitalized in another hospital in the past. That is why the patient medical file, which was an absolute necessity, is now a reality, and it has 45.1 million of a budget. You know that, and you also know why it is very important. But apart from that, something else is needed. Emphasis should be placed on the infrastructure of the hospitals. Infrastructure that will allow the recording support of the medical work, which means that our hospitals need to be modernized. It is very important to modernize the physical infrastructure of hospitals, that is, to ensure the hygiene and the aesthetics of the hospitals. But this modernization needs to happen also in digital infrastructure. And this can be done by EDICA. I don't know if Mr. Karagiannis, the president of EDICA, is present here today, but this is something done and has a budget of 139 million euros. So this is actually happening thanks to the RRF funding. Third, we must place emphasis on supporting, recording incidents so that we can make the right decisions. And especially with regard to oncological patients. And we have a project of a budget of 29.4 million euros that has been implemented. And all these are very important, and emphasis has been placed on them. EDICA has undertaken actions in order to promote them. However, all these also prove the need to utilize our data. You know that in the past we were writing by hand and we didn't know who had been hospitalized, what tests they had gone through, what was the treatment administered, and what were the results of this treatment. So the digitalization of hospitals is also underway. It started with a slight delay, as you know, but it is currently underway. And this is how we're going to have the data on the history of the patient. Necessary medical data in order for us to be able to use AI. AI requires large volume of data, different sources, and quality of data. We don't want to have rubbish among the data. So data are absolutely necessary. They are critical in order for us to process them rightly and take the right decisions. All this sounds very well, but of course, now we need to focus on the role and the position of the country in the international arena. If a citizen leaves Greece and goes to a hospital abroad, will they know their history there? Or if we have a foreign patient hospitalized here, will we know the history? So you understand there has to be interoperability both inside the country but also with the other systems of the other countries. In our country, we are proud of having ensured interoperability. Gov.gr is very good with regard to the services provided to the citizens, but it is also very effective because we only need the consent of the citizen and we undertake all the processes, and including the medical ones. For example, the father or the mother wants to vaccinate a child during the COVID-19. You don't know, but they had to go through 6 different registries. The tax registry, the insurance registry, the citizens registry, in order to prove that the child was theirs and not of someone else, in order to make the appointment, and then the registry of the appointment in order to close it. And this is interoperability. So this interoperability needs to exist at global level so that a European can come here and we can know the history of this patient, always with their consent and always in a way that is efficient and effective. And this is also implemented in the context of the agreement signed between our country and other countries. Would you like to continue? Will I have some time to add some things in the end? I would like to talk about My Health app. I assume that you are aware of My Health app. You have probably installed it, and I'm sure that you also know of the application developed by EDICA with all the diagnostic tests, the referrals, the prescriptions, everything. For the first time, we have data available to us that we can use. For the first time, we have available data in general. But I would like to say the following. There is an adage saying that everyone needs to take responsibility of themselves. And what do I mean by that? I mean that we have the data, we have the history, we have referrals on our mobiles. Now we need to take charge of our health. We need to act proactively and we need to be smart because, okay, the experts, it's good to be smart. Okay, the state to be smart. But unless we do what we must do, no improvement will ever be made. And we also need to make this shift. We need to keep up with the developments pertaining to our health Prevention has to do not with us only as individuals, but with the collective, with the society. Thank you very much, Mr. Anagnostopoulos.
Thank you. That was very important to see what happens as far as digital transformation takes place in Greece. Now I turn to Mr. Tsanas. We have been discussing about this hospital center system, that this health care service is offered in hospitals, and I would like your viewpoint. I know the research conducted vis-à-vis digital technology regarding the transformation of healthcare offered. And a second thing that I would like you to elaborate upon is whether this digital transformation may include exclusively health data or perhaps other data as well. Mr. Anagnostopoulos said that it could be interoperable. Good afternoon. I would like this, what Mr. Anagnostopoulos said, the shoemaker's shoes. Yes, I have 3 different devices registering things, but I think that generally speaking in the health system, we are away from merely having doctors monitoring. We should reach the point where we should monitor our health ourselves. We do have the systems on the mobile phone and elsewhere so as to monitor the cause, to monitor symptoms, the way interventions can be exploited and so forth. And of course, we move beyond the purely health data. We also monitor our sleep and sleep patterns, swells, and whatever. So there's a major movement, and the last 15-20 years, we can register a lot of data. A lot has been done in research everywhere in the world. Even the clothes we wear can register our heartbeat or whatever. There are systems in the house that they can monitor our movements. So I believe there is a major technological development and data that we register that we can exploit. One of the things that I use is voice. Voice is a very strong signal. We can identify through voice partners whether someone is prone to Parkinson. From the location, we can monitor movements and see whether someone is depressive. There are many points and signals that we can register and we can exploit so as to make timely diagnosis, monitor the evolution of ailments to see if a patient has had an operation or anything else. So there's a great interest in exploiting all that. I realize that Mr. Anagnostopoulos touched upon many things vis-à-vis the hospital transformation. I believe that your viewpoint has to do with what happens with management of patients before the hospital, screening, knowledge management, and so forth. And something more. Is there a possibility beyond the health data, either in the sector of prevention and screening or in hospital care, can we integrate other data, geolocation, for instance, or socioeconomic data, and perhaps use them in the file of digital health? Well, there is a company in England, established by Greeks, who record the spending pattern of a person. One can make identification of whether he's manic depressive, going on shopping sprees, and so forth. So these are things that can be exploited, of course, if someone has given one's consent to use, of course, that data. There is a continuum, if you like. If someone is healthy, there are tools that are extremely useful. Thank you for this first presentation. Now let us move to Madam Psalti, who has been working for more than 8 years in Microsoft in the engineering department, but also is very active in the field of health. Could you give us your viewpoint on the basis of two things? First, what are the activities of this major company, Microsoft, in the field of technology, and whether there are actions having to do with the governance of AI and health data, not only in the technical part, the technical aspect, but also in what we call governance. What are your actions and how can they inform our discussion on digital health? Thank you. Thank you for the invitation. Great joy to be here. First of all, let me start with certain facts at the global scale, global level. We see that there are currently 3.5 billion people who have no access whatsoever to medical care. We also see that the cost of healthcare continuously increases. In the USA, for instance, we see that the health cost represents 20% of GDP of the country. And I believe that technology and AI can operate as a catalyst so as both to curtail cost and to assist the medical personnel to spend more qualitative time with the patients instead of administrative tasks. What we see from our viewpoint of technology, that is, that there are certain tools, such as Dragon Copilot, for instance, that help physicians, nurses to take notes on patient visits and thus do the summaries without having to write down and upload the data in their laptop and so forth. All these are voice activated, so they can spend less time with administrative tasks and spend more time with their patients. They may have access to the history of the patients. And we have worked with a number of hospitals in the USA. That was the project City of Hope, a network of more than 50 hospitals in the USA. And by implementing this Dragon Copilot, we saved 11,000 work hours from the medical personnel. We also work with some other hospitals, St. Luke conglomerate, for instance, that also has a lot of hospitals in its network, and they do on cancer. And they use the same tools in order to identify the patterns that they had from data they had amassed in many years, and thus they could accelerate their research by 10 years. Now, on the second question, on the issue of governance, what I would like to point out is that there should be a plan on how it can be used and integrated, the AI that is can be integrated in health issues. There are some best practices at international level, as well as the European Union and other international organizations. And I believe that decision-making should be affected on many layers: government, parts of the ecosystem, of hospitals, the medical staff, and patients themselves, of course. Thank you. We thank you both for the insight you gave vis-à-vis what you do, as well as governance that I'd like to keep for the discussion in due course. Now, let us move to Madam Spatharou. I would like a couple of things from you. First, Mr. Moscheles mentioned all those challenges on health systems. That was a very broad and in-depth approach. I would like your viewpoint vis-à-vis those smart systems, and I let the definition to be given by you. How could they operate as a tool to deal with all those challenges? And do you have any examples in mind where those smart systems have been implemented in any countries to address some of those challenges? Thank you. Well, the challenges on the national health systems are unfortunately common and easy to understand. Professor Moscheles gave a lot, but the most important problems I see currently are on how they give greater access to the citizen to high-quality health services, how they can improve the patient's experience in order for the patient not to have duplication, delays, problems, and along with that, how they can create a financially viable system in an environment which combines a bad experience of the personnel in the system or the nurses when we lack hundreds of thousands of personnel in the global health system. We cannot import that as anyone. What we do. In the past, I had worked in the Northern America and Latin America. Now I'm in charge of Southeastern Europe. So I've seen various systems faced with the same problem. So at the first stage, we put into application new organizational models that is focused on working smarter, not harder. How we can use that as technology so as to have greater productivity in the system without overlapping and reiterating the same. For instance, taking the patient's history with every new physician. The other is the new care models, which actually try to bring health at the primary sector and the community center. So this entails, of course, the existence of data banks that create a unique and single picture of the patient and have a great understanding of the overall picture of the clinical image, the clinical picture of a patient. The third thing that systems do is digital first. That is, they set digitization with the support of AI as the entry gate in the health system. And this they do focused on what is used user-based design. Imagine all of us will have access to applications in private sector that are being created through the years on the basis of the experience we've got when we have access to specific service. Banks, for instance. We didn't have the same rationale in health. This user-based design is very important because if we create systems that are not suitable to the patient or the physician or the nurse, they will not use it. And this happens. So what have I seen in the last years? There are various countries that systematically invest in this field. Let me just mention small ones such as Estonia, up to Germany, the e-system there, or Singapore, Smart Nation, Australia, Canada, and of course UK, where Ilias and myself are based. In the UK, therefore, in the last years, NHS App has been introduced, the central application of the National Health System. This application has access. It is mainly used by 36 million citizens approximately of England, not of the UK, England. And at this point, first stage, anyone can enter and find the desired physician, set an appointment, see the elements from a medical visit, view the results of a medical test, and also get some piece of advice. What radically changes now, and I'll read it out because it is a brand new functionality, is that through this new program introduced for NHS, it will have the following applications. It will have a self-triage, that is, enter there, describe your symptoms, and take a first diagnosis. It will have self-navigation. You have all the health services supply, both of private and public sector in the area. There will be a chatbot who will be like a doctor of first care aid. There will be a digitized access to the data of the children. There will be a link with wearables, take beat and all that. So if you are if you do sports or do monitoring of your heartbeat, all that can be fed to medical teams. And we could also have digital diagnostics through the camera and digital therapeutics in certain aspects, such as mental health, musculoskeletal, and so forth. All that entail tremendous changes in the healthcare system and bring a new culture for the patient. And in concluding, in order to come back to the hospital part, the electronic health records have now started giving a picture of the movement of a patient in a hospital. But not only that, currently the modules now give the possibility to see where we are, have an estimate how long will stay someone hospitalized, link it to the primary sector or mental health. So if needed, a package of support is needed, will be offered, to come in contact with the relatives, so as for the relatives to know what they are to do when they receive an aged person with complexity, for instance. At the same time, have dashboards that allow the hospital to view real-time data where we have capacity, for instance, in the emergency room, in theaters, and so forth, but also introduce predictive analytics, AI enables, to see where we can have higher capacity, so as to have a more agile system that will be able to respond to the challenge of the system. I believe, therefore, that everything is coming to Greece. They will be coming here eventually. What could that entail for Greece? That could entail better access, greater satisfaction of the patient and the citizen, but also it might entail that in the long term, we might have a far stronger pharmaceutical industry by using the data that we already have at hand, and we may be using differently. Thank you.
Thank you very much. Now, about Greece, we will discuss in the second round in greater detail. Up until now, in the 30 minutes that have passed, we have mapped in a quite cohesive way the smart solutions in the healthcare sector. In primary level, in the hospitals level, and also in terms of prevention. My feeling is that the digital transformation, the digital transition, AI, actually go beyond the provision of health services and touches upon other sectors, including pharmaceutical care. There is now a discussion taking place about pharmaceutical policy, and I would like to talk about that. In all fora, we hear about the value-based care, about the value of data that allow us to develop value-based solutions. And the question I would like to put to Ioannis Pandis, who is head of the Pfizer hub in Thessaloniki, is, what do we mean by value-based care? What is your view? You are a person with an engineering background, if I remember correctly. Biomedicine, I apologize. You're not a health economist. You are more of a scientist. So what do you think about value-based care, and how can data inform such a process in which different stakeholders perceive this concept differently? Thank you very much, Ilias, for the question. And as we said before, I prefer to talk in English. It takes time for me to come up with the right Greek word. Όσον αφορά λοιπόν την περίθαλψη βάση της αξίας, είναι ουσιαστικά η στρατηγική που αναπτύσσουμε και χρησιμοποιούμε ως Pfizer στη Θεσσαλονίκη και στην Ελλάδα, αλλά και στον κόσμο γενικότερα. Γιατί το λέω αυτό? Θα ήθελα πρώτα απ' όλα να πω ότι οι περισσότεροι από εσάς γνωρίζετε για αυτή την αρχική επένδυση που έκανε η Pfizer στη Θεσσαλονίκη, και τα πρώτα 5 χρόνια ζωής ήταν συναρπαστικά. Αναπτυχθήκαμε, ξεκινήσαμε με την ψηφιακή καινοτομία και ίσως κάτι που δεν γνωρίζετε όλοι είναι ότι ενσωματώσαμε και συναδέλφους από τα τμήματα έρευνας και ανάπτυξης, κυρίως από το τμήμα ανάπτυξης, ούτως ώστε να κάνουμε διάφορες μελέτες και να προβούμε συνέχεια στην υλοποίηση των διαφόρων πρωτοβουλίων. Έχουμε επίσης ειδικό τμήμα για την φαρμακοεπαγρύπνηση και έχουμε και άλλο τμήμα για τις παγκόσμιες υπηρεσίες. Αυτό που προσπαθούμε να κάνουμε κατά βάση σε συνεργασία με τους συναδέλφους μας εδώ στην Αθήνα, οι οποίοι βεβαίως έχουν πολύ μεγαλύτερη παρουσία από ό,τι έχουμε εμείς στη Θεσσαλονίκη, είναι να δημιουργήσουμε ένα μίνι οικοσύστημα Pfizer, είτε στις εγκαταστάσεις είτε στη χώρα γενικότερα, συνεργαζόμενοι με τους βασικούς εμπλεκόμενους φορείς, όπως είναι η κυβέρνηση, οι οργανώσεις των ασθενών, οι εταιρείες βιοτεχνολογίας, τα πανεπιστήμια. Προσπαθούμε με άλλα λόγια να προωθήσουμε αυτές τις καινοτομίες στον τομέα της υγειονομικής περίθαλψης βάση αξίας. Γιατί έκανα όλο αυτό τον πρόλογο? Διότι για να καταλάβουμε ποια είναι η αξία που αποκομίζουμε, θα πρέπει να είμαστε σε θέση να μετράμε. Οπότε θα ήθελα να σας ευχαριστήσω για αυτή την ερώτηση και όντως έχω ένα επιστημονικό υπόβαθρο. Έχω εξετάσει για πάρα πολλά χρόνια την επίδραση ενός αιμορρείου σε ένα άλλο. Επίσης έχουμε εξετάσει διάφορες θεραπείες που εφαρμόστηκαν στα ποντίκια και είδαμε ίσως ότι δεν μπορούν να εφαρμοστούν σε άλλα είδη. Ουσιαστικά αυτό που έχουμε καταφέρει είναι να συλλέξουμε όχι μόνο ποσοτικά αλλά και ποιοτικά δεδομένα, ούτως ώστε πράγματι να αναπτύξουμε αυτή την πολιτική υγείας βάση αξίας. Ως Pfizer και πάντα σε συνεργασία με πολλούς εμπλεκόμενους φορείς, προσπαθούμε να δημιουργήσουμε αυτό το οικοσύστημα που θα περιλαμβάνει τα μέσα μέτρησης. Γι' αυτό λοιπόν και έχουμε ενσωματώσει ψηφιακά μέτρα υγείας που αναφέρθηκαν και πρωτήτερα. Μπορεί, παραδείγματος χάρη, κάποιος να φοράει ένα ρολόι ή έναν αισθητήρα περιβάλλοντος ή κάτι άλλο, τόσο ώστε να συλλέγει δεδομένα. Διότι αυτό που βρήκαμε ως Pfizer, δεν θέλω να σας πω, και κάτι που επιβεβαίωσαν οι οργανώσεις ασθενών, είναι ότι κανένας δεν θέλει να αισθάνεται ασθενής 24 ώρες το 24ωρο, οπότε όσο περισσότερη διάδραση έχεις μέσα στο σύστημα, τόσο λιγότερες πιθανότητες να το χρησιμοποιείς. Άρα, καλό θα ήταν, και όντως το έχουμε παρατηρήσει αυτό, ότι όταν οι ασθενείς φοράνε κάποιες συσκευές που δεν τους υπενθυμίζουν ότι είναι ασθενείς, τόσο περισσότερο τις χρησιμοποιούν. Θέλω να αναφέρω μία νεοφυή επιχείρηση η οποία έχει αναπτύξει βραχιόλια για γυναίκες, πανέμορφα βραχιόλια, τα οποία όμως συλλέγουν δεδομένα. Πάρα πολύ καλός σχεδιασμός και εσείς αναφέρατε νωρίτερα πόσο σημαντική είναι η εμπειρία του χρήστη. Εγώ έχω ζήσει στο Ηνωμένο Βασίλειο, έχω βιώσει τι σημαίνει το εσύ εκεί, έχω δει εισόμαση αυτές τις υπέροχες εφαρμογές που έχουν αναπτύξει οι συνάδελφοί μας. Πιστεύω ότι έχουμε ακόμα χώρο βελτίωσης ως προς την εμπειρία του χρήστη. Πιστεύω ότι μπορούμε να βελτιώσουμε τον σχεδιασμό αυτής της εμπειρίας. Και τώρα, αν προσθέσουμε την ικανότητα να ενσωματώσουμε σετ δεδομένων από διαφορετικές πηγές, δηλαδή αν μπορούμε να έχουμε διαφοροποιημένα δεδομένα που θα είναι είτε οικολογικής φύσεως είτε περιβαλλοντικής φύσεως και στη συνέχεια να περάσουμε μέχρι και στα γενετικά δεδομένα, κάτι που ανέφερε και ο κύριος Μόσιαλος, θα μπορέσουμε να εντοπίζουμε πραγματικά μοτίβα και έτσι στη συνέχεια να εκπαιδεύσουμε τους επαγγελματίες υγείας καθώς και την τεχνητή νοημοσύνη. Θα μπορούμε να φορτώνουμε, ας πούμε, ένα μοτίβο στην τεχνητή νοημοσύνη και να ρωτάμε, ωραία, πες μου τώρα τι κάνει αυτό ή γιατί είναι υπεύθυνο. Επίσης, κάτι που θα συζητήσουμε και στη συνέχεια είναι πόσο σημαντική είναι η τυποποίηση. Εγώ δεν θέλω να πω ποιο μοντέλο τεχνητής νοημοσύνης είναι το καλύτερο, διότι δεν γνωρίζουμε και πιστεύω ότι είναι μια τεχνολογία που αναπτύσσεται ραγδαία και κανένας δεν μπορεί να προβλέψει ποιες θα είναι οι εξελίξεις. Αν έχουμε όμως καλά θεμέλια που άπτονται της ποιότητας των δεδομένων και αν έχουμε και αυξημένη διαλειτουργικότητα, τότε θα μπορέσουμε εγκαίρως να εντοπίσουμε τις πιο αποτελεσματικές τεχνολογίες. Τουλάχιστον βραχυπρόθεσμα, διότι οι εξελίξεις είναι ραγδαίες, ανά εβδομάδα. Σε ευχαριστούμε πάρα πολύ, Γιάννη.
Θα ήθελα να συζητήσουμε δύο άλλα πράγματα τώρα, Σίτε. Μέχρι τώρα συζητήσαμε επί μακρά σε ό,τι αφορά την αξία του μετασχηματισμού και στην πρωτογενεία περίθαλψη και στην νοσοκομιακή. Έρχονται με κάποιες προκλήσεις αυτοί οι μετασχηματισμοί. Το θέμα μου είναι από πλευράς της βιομηχανίας διαγνωστικών. Πώς μπορούν να βοηθήσουν την αντιμετώπιση αυτών των προκλήσεων? Έχεις καλά παραδείγματα υπόψη σε παγκόσμιο επίπεδο? Θα ήταν ενδιαφέρον να το ακούσουμε. Ευχαριστώ πολύ. Χαίρομαι πολύ που βρίσκομαι εδώ. Τα διαγνωστικά τα θεωρούμε σαν τους σιωπηλούς πρωταθλητές της φροντίδας υγείας. Είναι κρίσιμη σημασία γιατί η πρόληψη, η διάγνωση, διαγνωστικά εξαρτούν τα πάντα. Οι κλινικοί εξαρτούν το 80% των αποφάσεών τους στα διαγνωστικά, αλλά παίρνουν μόνο το 2% του διαγνωστικά του παγκόσμιου, της παγκόσμιας επένδυσης. Αυτό σημαίνει χαμένες ευκαιρίες για τους ασθενείς και για τα συστήματα. Πρέπει να απομακρυνθούμε λοιπόν από το να βλέπουμε τα διαγνωστικά σαν κάτι εναλλακτικό στρατηγική επένδυση. Εάν δούμε τα παγκόσμια συστήματα υγείας, υπάρχουν πάρα πολλές προκλήσεις που αντιμετωπίζουμε αυτή τη στιγμή. Προφανώς τον διδάσκοντα πληθυσμό. Επιπροσθέτως υπάρχουν παγκοσμίως αναδυόμενες απειλές, αλλά βλέπουμε και την τεράστια ποσότητα στοιχείων που παράγουμε και που διπλασιάζονται κάθε επταήμερο. Αυτό είναι τεράστια πρόκληση, αλλά και ευκαιρία. Ο Παγκόσμιος Οργανισμός Υγείας ανέπτυξε μια στρατηγική ψηφιακής υγείας που αποδεικνύει ότι μπορούν να βελτιωθούν τα αποτελέσματα, αρκεί η στρατηγική αυτή να είναι κλιμακούμενη, αειφόρο, προσιτή και οικονομική. Βλέπουμε παρόλα αυτά πολλές προκλήσεις. Είναι κατακαιρματισμένο το τοπίο. Βλέπουμε τα συστήματα αποζημιώσεων και χρηματοδότησης να υπολείπονται και βλέπουμε επίσης ότι υπάρχει έλλειψη εμπειρογνωμοσύνης και γνώσης ό,τι αφορά τις ψηφιακές λύσεις. Και αυτή η έλλειψη εμπειρογνωμοσύνης οδηγεί σε έλλειψη εμπιστοσύνης. Εάν δούμε καλά παραδείγματα που λαμβάνουν χώρα σήμερα και υπάρχουν πάρα πολλά, και ο τομέας των διαγνωστικών είναι περήφανος γιατί συνεισφέρει παγκοσμίως. Να σας δώσω ένα παράδειγμα από κλινικά εργαστήρια, όπου μπορείτε να ενσωματώσετε στοιχεία των ασθενών μαζί με αποτελέσματα εργαστηριακών εξετάσεων και να καταλήξουμε σε κλινικούς αλγορίθμους που δίνουν στους επαγγελματίες νέες συστάσεις για ποιο είναι η καλύτερη πορεία και σύσταση για το καθεστώς που θα εφαρμοστεί στον ασθενή. Ένα άλλο παράδειγμα είναι όταν βλέπουμε κατοίκον ασθενείς. Η διαχείριση του διαβήτη έχει πραγματικά επέλθει επανάσταση με συνεχή παρακολούθηση της γλυκόζης. Τώρα θα υπάρξει και καινούργια εξέλιξη συνδυάζοντας με τα στοιχεία του ασθενούς για να δούμε και να προβλέψουμε ποιες θα είναι οι διακυμάνσεις του γλυκόζη. Οπότε μπορούμε να προβλέψουμε αν θα έχει υπογλυκαιμικό σοκ, για παράδειγμα, ο ασθενής τη νύχτα ή όχι. Οπότε διαχειριστούμε σε όλο το σχετικό του pattern συνδυασμού, δηλαδή τροφής και φαρμάκων. Κάτι άλλο που βλέπουμε είναι στην ψηφιακή παθολογία, στην ογκολογία για παράδειγμα, όπου τώρα μπορούμε να ψηφιοποιήσουμε πλήρως την βιοϊψία που έχει ληφθεί με τις ψηφιακές εικόνες, όπου μπορούμε να εφαρμόσουμε κλινικούς αλγορίθμους για βέλτιστες διαγνώσεις και μεγάλης ακρίβειας θεραπευτικό σχήμα και επίσης να στείλουμε τα στοιχεία οπουδήποτε στον πλανήτη για να υπάρξει δεύτερη εμπειρογνωμοσύνη, δεύτερη γνωμάτευση που επιτρέπει σε διατομεακές ομάδες από όλο τον κόσμο να προετοιμαστούν για συναντήσεις πολύ πιο γρήγορα, να λαμβάνουν τις αποφάσεις πιο γρήγορα και για να αποφασίσουν για πιο συγκεκριμένες και πιο σημαντικές δράσεις, όπως για παράδειγμα την διενέργεια κάποιες επέμβασης. Στην Ελλάδα τώρα βλέπουμε ότι έχει γίνει πολύ μεγάλη πρόοδος με ηλεκτρονική συνταγογράφηση και ηλεκτρονικούς φακέλους ασθενών. Επίσης, αν δείτε τα θέματα καινοτομίας και την έρευνα, είναι η μεγαλύτερη κατηγορία απορρόφησης δαπανών αυτή τη στιγμή. Τι βλέπουμε αυτή τη στιγμή? Η τρέχουσα νομοθεσία δεν ευθυγραμμίζεται με τα τελευταία πλαίσια που είδαμε αναπτύσσονται στο Ηνωμένο Βασίλειο. Υπάρχει έλλειψη λοιπόν σωστού πλαισίου αξιολόγηση της ψηφιακές λύσεις και έλλειψη του προσέλκυσης των σωστών κονδυλίων. Επίσης έχουμε διδράστο πληθυσμό στην Ελλάδα. Ξέρουμε ότι το 2030 το 25% του πληθυσμού θα είναι πάνω από 25, πάνω από 65. Αυτά στην συνδυασμό με την πολύπλοκη γεωγραφία, τις αγροτικές περιοχές, τα νησιά, κάνει την Ελλάδα το τέλειο χώρο για να καινοτομήσει με ψηφιακές λύσεις. Ποια θα είναι η πορεία λοιπόν, πώς θα γίνει? Ας συνεχίσουμε να επενδύουμε στα στοιχεία και στην υποδομή υγείας, ας εξασφαλίσουμε ότι θα ενημερώσουμε τη σχετική νομοθεσία με τις τελευταίες εξελίξεις και ας διασφαλίσουμε ότι θα απομακρυνθούμε από την κατακαιρματισμένη μεμονωμένη προσέγγιση σε ένα ενοποιημένο μοντέλο όπου η νοοτροπία αλλαγής θα είναι κρίσιμη σημασίας. Αν τα κάνουμε όλα αυτά σωστά, οι πάντες θα έχουν πρόσβαση στη σωστή διάγνωση, στη σωστή ψηφιακή διάγνωση για να μετασχηματίσουμε το όλο ταξίδι ενός ασθενούς. Ευχαριστούμε πάρα πολύ. Ευχαριστούμε πάρα πολύ. Και τώρα στην παρουσία σου κρατάω ότι ήταν 3 τα επίπεδα ψηφιακού μετασχηματισμού στον τομέα της υγείας από την οπτική σας, στις κλινικές, στην κατοίκον νοσηλεία και βέβαια σε όλο το σύστημα και την διεπιχειρησιακότητα των στοιχείων. Ευχαριστούμε πάρα πολύ. Και τώρα δίνω το λόγο στον Αντώνη. Ο Αντώνης ήταν ένας από τους πρώτους που θυμάμαι που μίλησε για πραγματικά απτά στοιχεία στην Ελλάδα. I would like your viewpoint vis-a-vis this whole discussion on data. I realize that you come from the pharmaceutical industry, so I would like you to focus there. And since you've got a broad experience on the subject, for 15 years if I'm not mistaken, I would like you to give us your viewpoint, where we are vis-a-vis the real-world evidence, what we want to have that is fed in the system, and which are the major challenges. Thank you, Ilias, for the question and the challenge and the invitation. Indeed, the use of real-world evidence has boosted this industry in many aspects, from clinical research where we can lead through AI to identifying limits. My company, for instance, where I work, an AI platform invented composition of molecules, and it writes it can offer up to 100 candidate molecules next month for each category, which is indeed an acceleration, a tremendous acceleration in discovering new molecules that then they can be introduced in clinical trial. So it's an issue of accelerating clinical trial. Another great contribution is clinical trial, development of drugs and clinical trials, when we can design far faster clinical studies on the basis of population, collect data in a swifter way, and of course analyze data in a better way. And the third part is in the use of drugs in daily clinical practice, where by using data, we can see the value of drugs in daily practice. We can assess which population will need the new therapies. We can have better epidemiological data analysis and assess for which patient group it's better to use a specific medication. And pharmaceutical companies do so. That is, they cooperate with companies that have big data banks, which offer the possibility, through that data analysis, to have useful conclusions for clinical analysis on the effectiveness and value of medication in daily life. My company has a steady cooperation with Maccabi in Tel Aviv with databases of the UK. They all secure through those cooperations the possibility to develop cooperative research protocols of the various treatments and use that data and those protocols so as to plan clinical trials or document the safety of the products of the pharma industry. When we first presented in Greece the system of e-prescription, they said it's tremendous, such a system, such as the one of Greece, that has such a big number of specialized doctors in primary care, that has such a huge geographic distribution population and so differentiated needs per region, could be a very lively laboratory so as to test the safety and effectiveness of new medication and relate that with geography and environmental conditions, financial dimensions, and so forth. So, on this idea, we wrote a paper with Ilias' father, Professor Kyriopoulos, which was distributed to the government and was presented to all the health services. I believe that this strategy is always topical for a series of reasons. First, because we have proceeded thus in the digital modernization. We have the data, the infrastructure through the ministry, and now we can collect all the data and use it. A second element is that we have the know-how in many areas of society, consultants and IT and patients, so as to proceed. We have a tremendous impact on national economy. If on every 1 million invested on real-time data, it gives us 24 jobs and almost 1,000 millions of return. So the return on investment is equal to production. And finally, it could be the basic mechanism.
With regard to clinical trials, the Swedes developed the registries that are renowned for their effectiveness in an effort to attract clinical trials to Sweden. They are also a small population, English not the mother language. They wanted to attract the clinical trials, and they were successful. And I would like to make the comparison with Greece, where we have a registry now. We have 12 hospitals that we have a specialized oncological file of patient, and we have therapeutic protocols. So if we can come up with a national strategy that will allow us to analyze the relevant data, and if we have the scientific team, be it from the university, be it from the hospital, responsible to publish this data, then all the people who are taking part in this process will be able to attract clinical trials for diabetes and for the 10 biggest therapeutic categories. So we are going to create a group of researchers and of experts who will be able to assess the effectiveness of a drug from an early stage up until the last stage, and will allow the country to develop a center for excellence, clinical excellence. What do we need in order to do that? First of all, a national strategy, which is quite a difficult task because we're talking about a very fragmented space. We have different stakeholders. Everyone is focused on their own side. And I believe that the national government needs to take action in order to come up with this national strategy. Secondly, we need to have the data, not just collect and analyze. We need to follow a different approach to data in order to ensure their best use. And last but not least, we could actually establish a body that will invite the pharmaceutical companies, the IT companies, the academia, and the research community in order for them to highlight the value of this strategy that in turn would turn Greece into a major scientific and excellence hub and would attract scientists from abroad. Thank you very much, Antonis. So, Labrina Spiros, you have a proposal on how the Chamber can take some action in the sector. I would like to thank all the speakers, since we don't have much time. And, okay, since some of you spoke a little bit longer, maybe I'm responsible of that. I would like to close this discussion. You have 30 seconds each. So I would like each of you to make a comment on the meaning of digital transformation. And I would like you to give me a specific enabler with regard to digital transformation in Greece. Is there someone who would like to comment on that? Anyone? Can I say something about today's discussion? Usually, when one takes part in discussions, and with such a big audience, they tend to hear some things that are already given. The fact is that the synthesis of today's panel and the ideas expressed are very useful, along with the recommendations made to the government. One could take a note of all these proposals and ideas, send them to the competent ministries, because it is not just one ministry involved in this discussion. There are at least 3. So that then we can come up with some bullets that can then be used. So if there is the possibility to take down some ideas that have already been expressed here, it would be a very, very productive thing. Another proposal. There is the recording of the session, so I will do it, don't worry. We can also use Copilot. Mrs. Spatharou, just one thought, please. Very often in the different countries and the different systems in the public sector, we do what we can with the available funding. If there's 20 million, there are 20 millions, we use them accordingly and appropriately. But what makes the difference is the strategy that allows for the best use of data. It allows us to understand what is the best architecture for collecting and analyzing data, and then to decide which are the stakeholders that will take part in the wider effort. If we do that systematically, we will go faster and reach a more distant destination. So what we need is a cohesive plan, just like the one that exists in NHS for decades now. Ένα σύντομο σχόλιο, και εγώ τώρα θα γυρίσω στα αγγλικά. Ένα πάρα πολύ μικρό αλλά ενδιαφέρον στοιχείο είναι ότι πολύ σημαντικό να ξεκινεί κανείς αργά, αλλά σταδιακά, να αποδεικνύει την απόδοση επί της επένδυσης σε κάθε βήμα. Μαθαίνουμε σε κάθε βήμα και στη συνέχεια μπορούμε να επικοινωνούμε την αξία όλων των ενσωματώσεων και των μετασχηματισμών που ηγούμαστε. Σας ευχαριστώ πολύ. Δεν μαθαίνουμε από τα λάθη του παρελθόντος, ούτε από τις καλές περιπτώσεις. Αυτό ισχύει για πάρα πολλούς τομείς και για πάρα πολλά έργα. Υπάρχει το BBMRI, υπάρχουν οι βιοτράπεζες για τις οποίες συζητήσαμε. Δεν είμαστε σε θέση να χρησιμοποιήσουμε κάποια από αυτά τα έργα ή κάποιες από τις ευρωπαϊκές πρωτοβουλίες στις οποίες συμμετείχαμε. Άρα θα πρέπει να ξεκινήσουμε αυτό. Διαφορετικά θα επιστρέφουμε ξανά και ξανά στο θέμα της χρηματοδότησης. Και κάποιος αναφέρθηκε στα εμπόδια και στους φραγμούς. Κάποιος είπε ότι όλοι επικεντρώνονται στις δικές τους πρωτοβουλίες και στα δικά τους σχήματα. Γιατί να μην προάγουμε περισσότερο τις ΣΔΙΤ? IMI, MRC, BBS, διαφορετικές οντότητες μπορούν να συνεργαστούν ώστε να αντιμετωπίσουν τα εμπόδια από κοινού και στη συνέχεια να συναγωνιστούν. Σας ευχαριστούμε πάρα πολύ. This strategy requires collaboration. It requires an open-mindedness so that all the different aspects of the topic can be covered. Okay. Δεν πρέπει να δεν πρέπει να ξεχνάμε πόσο σημαντικό είναι να αλλάξουμε την νοοτροπία μας, να προάγουμε την εμπιστοσύνη και βεβαίως να βελτιώσουμε το νομοθετικό πλαίσιο. Όλα αυτά θα μπορέσουν να κάνουν τη διαφορά. Σας ευχαριστούμε πολύ. We are 30 seconds behind schedule. Thank you all very much.